Hey everybody, it's Matt Shu with Josh Hash here at Upright Health, and today I wanted to share kind of a case study with you with a client who just started here a couple weeks ago who was having a lot of trouble with her neck and her shoulder just kind of seizing up and just feeling really uncomfortable. Anytime she did any kind of exercise at all, even the lightest exercise would just cause everything to seize up. Her attempts to kind of fix this over the last 5 to 6 years included acupuncture, chiropractic, physical therapy, just self-massage, tons of massage, and nothing really seemed to help it. Everything would just flare things up, and so she came here looking to see if there was some way she could massage it differently or train differently to try to get things to work better. And it was a really interesting situation. So I thought I'd make a video and share it with you so you guys could just kind of see it, think about it, and think about how it might apply to your situation. So just as an overview of what was going on, her mid-back and right along the shoulder blade, so here's Josh's shoulder blade, all along here with the spinal erectors, the rhomboids, and the mid-traps would seize up and just kind of feel like they were like frozen, stiff, tight, and then just get really achy and painful. So all this and all here, so this would be kind of upper traps and supraspinatus, and then up into the neck. So you're thinking about levator scapula. And all of these things, basically if she did any kind of motion, like abduction, so Josh is going to show you, like if he just raises his arm out like that. So that kind of motion, any kind of exercise that started to do that would cause irritation up here. Going overhead would cause irritation. Doing things like arm circles, like simple exercise like this, would start to get everything flared up. Doing rows like suspension rows with a suspension trainer like the TRX would get everything flared up. We tried an exercise we showed you in a previous video, the simple lat exercise, just pulling down with the bands there. That would get everything annoyed. So we tried a bunch of different things to see if that would help. We did some massage and self-massage all up in this area that was really tight, but keep in mind she'd been doing that for like 5 to 6 years, and that wasn't really helping. So basically we're looking at the situation as what's left, what can we possibly try? Because even a simple exercise like pulling the shoulder blades together, just like that, that was starting to flare things up too. So we're sort of at this position where we're like, there's nothing clear to do. How do we make this stop hurting if every single small thing and every kind of more aggressive intervention doesn't help? So having exhausted all of our options while standing, we came down to the floor to the hook lying position to kind of see if there were some other regressed exercises we could do to help free up the shoulder motion and make things a little bit cleaner. So there were two exercises that we tried. First was the hook lying reverse presses. So basically you got knees bent, feet flat on the floor, and then you try to pull the shoulder blades in towards each other. So Josh is doing this perfectly well. You just pull the shoulder blades in and relax, shoulder blades in and relax. Now, when this client started trying to do this exercise, what she was doing was actually raising her elbows and then pushing her elbows down towards the floor, which was not exactly the motion I wanted. So I just asked her to try to pull the shoulder blades in a little bit more, and she did better, right? And we just wanted to see whether she could even do this exercise and get fatigue in the right muscles between the shoulder blades, like the rhomboids and the mid-trap. So we did that for a little bit, probably about 30 reps, and then I wanted to test to see how her range of motion was. So we had her do the hook lying pullovers, which is basically putting palms together, hands together like that, and then coming down towards the floor. And so she ended up stopping right around here, and then ended up with a sensation of pinching and compression in the front of her shoulder, which is not good. Nobody likes pinching and compression in their shoulders. So she kept trying. Sometimes this kind of thing loosens up when you keep trying, but it was actually just aggravating the shoulder more and more. So what I had her do was here in this position, sometimes you can kind of trick your body. So I had her push in towards me here a couple times to kind of activate some muscles on the side of the shoulder, and then checked it to see if that would improve the range. It didn't improve it at all. Then I had her push over this pushing that direction a couple times, and then retested, testing to see if she could get a little bit further. Didn't really help. I had her push this way into my hands, so she's trying to push down and strengthen some of those, activate some of those muscles. on the anterior portion of the shoulder. That didn't really help. I went this way to see if maybe kicking in some of the muscles like the lats and the triceps might help. That didn't help either. So we went back to the reverse presses to see if she could actually get some fatigue now that we had just kind of moved things in that position. So we went into the reverse presses, and this is where things got a little bit more interesting. So I mentioned earlier she was doing the elbow raising, and she was getting a little bit better at pulling the shoulder blades together. So to help, sometimes you can use your fingers and just kind of put the fingers right between the shoulder blades so somebody can feel those muscles working. So I put my fingers right under there, and in this position I'm actually able to poke at her ribs, right? So when the shoulder blade is pulled apart, you put your fingers there, you're basically touching the rib cage if you're a little bit off to the side of the spine. So I asked her, hey, can you feel what I'm touching here? And her answer was, I think you're touching my shoulder blade. And that was wrong. So I said, no, that's actually your rib cage. And she said, oh, okay. So then I had her pull her shoulder blades in together. And then once the shoulder blades are in together, I'm now touching her shoulder blade. Okay, so that's the spoiler for you. I asked her, what am I touching now? And she said, shoulder blade. Cool. So then I had her relax her shoulder blades again, and then now I'm touching the ribs. I said, what am I touching? And she said, ribs. So that was perfect. So we did that a couple times and in a couple different positions all along the border of the shoulder blade. So if this is the shoulder blade, I kept having my fingers here. She'd pull in, and then my fingers would be touching the shoulder blade, and then the shoulder blade would move. I'd be touching ribs. Shoulder blade, ribs. Shoulder blade, ribs. So we did that a bunch of times all along the shoulder blade, and by the end she was getting no more of the weird kind of the weird sensations along the shoulder blade. She wasn't feeling like there was constriction. She wasn't feeling the tightness, that freezing stiffness, and she could feel the actual shoulder blade moving along the rib cage. So we did that a bunch of times, and then we went back to the pullover and retested the pullover to see how it felt. And this time she got all the way down to the floor without any restriction in the shoulder. So just by clearing up for her where her shoulder blade was and how it was positioned in relation to her rib cage, she was suddenly able to get a lot better range of motion out of that shoulder. And so what happened actually over the next week was she was doing homework, doing some of these simple exercises like shoulder retractions, standing shoulder retractions, and they didn't aggravate her shoulder, which was super cool and very unexpected, just from doing a little bit of kind of recalibration and fine-tuning so that she could actually feel the right stuff. So it was a really neat experience to see firsthand, and I thought I'd share it with you guys so that you can kind of get an appreciation for how complex some things can be, and yet how simple some of the solutions can be. If you're willing to actually experiment a little bit, not necessarily go charging at every problem, but experiment a little bit, a lot of times you can find really interesting, unexpected solutions to people's movement problems. So after that, we have been able to progress her shoulder training to be a little bit more difficult, and we'll continue to do so. So hopefully you like this video and you like this content, and if you do, please do subscribe to our channel. And remember that pain sucks, life shouldn't.